I think this is a very good format to go through. Figure out good plans, not just kind of bring ideas that we just want to throw back and forth, but really come with a good strategic plan on something that you know is going to achieve both equity metrics and drive us towards reopening, which is what we've always talked about, is the smart way to approach the yes and scenario, not the either or. I say this because, as you all know, there's an exceeding amount of frustration that just continues to burn in our community. And what it is it's a lot of times we talk about the inconsistencies, right? Like, well, why can I do this but not this? Why have I kept my business closed and my church closed if I still see numbers rising from things that I have nothing to do with and I've been compliant? And when government gets into a place where it is regulating and keeping good actors who want to act responsibly from acting responsibly, and then they look at us and say, are you guys managing your parks? Are you managing the other things? Are you managing what we hear are crazy parties all over the place, the things that we are not causing an increase and we're getting the detriment from it? It's a very tough pill to swallow. I say that because this is a community challenge. It is not just a County of Sonoma as a government agency challenge. This is truly a Sonoma County challenge. I'm going to use it as an opportunity to have a call out to our community, because we need employers and businesses not to just look at us as government and say, fix this equity issue. We need employers to be working to set up testing programs with their employees. So this is a call out to call our offices, work with our health staff and others to make sure that you're a part of the solution.
Okay, well, thank you so much again for having us present. First, what I'd like to do is give a short overview on how Sonoma County is doing, where we stand on the state measures and metrics for reopening. Then we're really going to dive down deep into health equity and the enhanced COVID-19 response strategies that public health has put together, including the expanded intensive and data-driven testing, which we've been doing all along, but are now doubling and tripling in terms of efforts, enhanced outreach to the Latinx community, the incentive program and financial assistance packages, partnership with our business community, isolation quarantine support, our communication promotion campaign, and the fiscal impacts of our proposed strategies. So to start off with, let's get a brief overview of how the state decides when it's safe for a county to begin to reopen. There are three different questions that are being asked. The first one is how many new people are infected by COVID-19 each day in the county. And that really is the measure that looking at new cases per day per 100,000 population. The second thing that's looked at is what percentage of the tests are positive for COVID-19. And that's what we're calling test positivity. How many cases do we have over the total number of tests being done? The third measure we're looking at is COVID-19 harming some parts of the community more than others? And this measure is health equity. And we'll go into that a little bit more deeply in just a second. Again, for a little review, we do have 4 tiers that were announced in the Blueprint for a Safer Economy that was announced by Governor Newsom on August 28th. Tier 1 is the purple tier, and that is where we think that widespread transmission of COVID-19 is occurring. Many non-essential business operations are closed in this tier. The next tier down is Tier 2, or the red tier, where we think substantial transmission of COVID-19 is happening in the community. And in this tier, some non-essential businesses are closed. In Tier 3, the orange tier, we think there's moderate transmission of COVID-19, and some indoor business operations are open with modifications. And then in the yellow tier, where we think we're really in a much better place and there's minimal transmission of COVID-19, most indoor business operations are open with modifications. So taking a look at that first metric, how many new people are infected by COVID-19 each day? Right now, our average number of new cases per day per 100,000 population is 13. And where do we need to be to go into the red tier? We need to have 7 or fewer new cases per 100,000 residents per day to move into red, or less than 35 cases a day. And right now, we are closer here to 65 cases a day. So that's where we are, and this is where we need to be. So looking at that second question, what percentage of tests are positive for COVID-19? That's the test positivity metric that we've been talking about. We are currently at 5.1% of all of our tests being positive, and this is over a 7-day average. And what this means is we are already in the red in terms of test positivity. And in fact, we were as low as 4.4%. So this does fluctuate over the weeks, but we've been in the orange to red, and right now kind of in the cusp between red and orange for test positivity overall. Looking at the third question the state is asking, is COVID-19 harming some parts of the community more than others? COVID-19 has definitely impacted some communities more than others, as we've been noticing here in Sonoma County. For us, really, it's the Latinx group, the low-income group, and the essential worker communities that have been disparately affected by COVID-19. And in order to open safely, counties must address COVID-19 in all people, all residents of our county, in all communities to open further. Making sure that the positivity rate, that same test positivity rate that we looked at, that was 5.1% overall, does not significantly lag behind in these affected communities. So this test positivity also has to be in the red in order for us to go into the red. So all 3 of these different metrics need to be in the red for us to go into the red. Now, how are we looking at who are the most affected in our community? With that health equity metric, the state has defined at the lowest 25% of our county in terms of this way of measuring the wellness and health wellness of the community is called the Healthy Places Index. It measures factors that predict life expectancy, for example, income, housing, and you can see the grid here, the graph, that it also looks at education, social and community, community conditions, the neighborhood, environment. All these different factors go into determining the Healthy Places Index. Each census tract in our county and all over the state is assigned a score based on this, an HPI score, with the higher scores indicating greater resources or access to resources, and the lower score indicating less access to these resources. So to move tiers, the testing positivity among the neighborhoods in the bottom quartile, or 25% of this Healthy Places Index, must meet the criteria of the new tier in which we hope to go into. So these are the 3 different things we're looking at: new cases per 100,000 per day, test positivity overall in the county, and then the test positivity in the lower 25% based on this HPI score. Which areas in our county make up the lowest 25%? Right here in the red, you can see these are the areas that where we have the lowest quartile, the lowest 25% of our census tracts. And this is the area in which currently our test positivity percentage is 7.5%. So we are already eligible for the red tier on the basis of this map. So before I go to why we're still in the purple, I just wanted to note that as our test positivity overall and in this lowest quartile, lowest 25%, these areas that are in red here on our county map go under 5% or into the orange, we will then be allowed to move into the red because we're one step ahead in these 2 metrics, regardless of our new cases per 100,000 per day, as long as the cases are stable and declining. So this is another thing to note. So we're in the purple, and as you can see, there are numerous counties, Mendocino and several other counties you can see here on the map that are still in the purple with us. A good chunk, probably 50% of counties, have gone into the red, and as you can see, some of the counties that are bordering our east border of our state, as well as the northern border, are actually in the orange and yellow. The reasons are multifactorial. There's a lot of things that go into why we are seeing what we're seeing in terms of COVID-19. I think we're following the same trend as other counties, but as you recall, when we went back to March and April, we were about 4 to 6 weeks behind in building up the numbers of cases that, say, for example, the other Bay Area counties had early on, and we still trail them significantly in the total numbers. And this is because we were pretty successful in holding off cases early on, and because we're lagging 4 weeks behind, we may see a change here in the coming weeks, just on the basis of the fact that we're behind on the curve. We've also had a lot of cases, as I've been presenting all along in the last months, associated with gatherings of non-household members. And public adherence to our health guidance, the social distancing, masking or wearing facial coverings, and general hygiene measures is critical. Every resident in our county has a role to play for themselves, their families, and for the community in order to slow the spread of COVID-19. And as you know, we have very strict gathering guidance, even now, limiting gatherings to under 12 persons and to 3 households. At most 3 different households gathering at once, and that is a new state guidance that came out in the last 1 to 2 weeks. We've also had outbreaks in multiple different sectors, and some of these sectors are very specific to our county. For example, agriculture and farm work, wineries, that is vineyards, that kind of thing. Those are fairly specific to our county and a few other counties and some of our bordering counties. We've also had outbreaks in the healthcare industry, in long-term care facilities, which is not at all specific to our county. That's been happening all over the state of California. And then in workplaces as well. We've also, as you know, presented the data from childcare facilities. We've had, luckily, not any big outbreaks in our jail or in our homeless populations at this time. Now, we've also had a lot of household transmission. In other words, as we've been presenting all along, the lion's share, the majority of our cases are occurring amongst household contacts to people who are cases. And we could have up to 30 cases in one household if there's very large households with more crowded conditions. And we have been seeing a lot of transmission in people who are also in the workplace, living in dormitories where they are in close contact with large numbers of people, 20 to 40 people in one housing complex. And so those are the places we've been seeing what we're calling household transmission. Tourism is also an area that is more specific here to Sonoma County. And as you know, we are a tourist destination. And I think many of you have seen that we do have a lot of people coming in to our tourist destinations. That could be affecting us as well. And then lastly, and definitely not least, the socioeconomic inequities that we've been talking about, the longstanding inequities that do place our most vulnerable residents at risk. And we know that residents with fewer resources throughout the state and throughout the country are facing barriers for protecting their health and are being disparately affected by COVID. So how do these inequities impact health? Well, it's really challenging for folks in some sectors and some areas to shelter in place, isolate, and quarantine when they're essential workers that are living on limited incomes and can't afford to miss work. And they have been working from day one, even when we had our stay-at-home order. These are people who worked in the essential industries. The lack of sick leave and benefits or job security to take time off when a person or their family member is sick has also contributed. Living in congregate or shared spaces, as I've already discussed. Shared transportation to and from work in vans have also contributed. Lack of access to health care, limited child care options, and the fact that sometimes people are very afraid have been contacted for contact tracing and other government services that are there to help them, like alternate care sites, but are wary of taking those opportunities. So what we need to do, and what we've been doing from day one, but what we need to continue to do and double our efforts to do, is to continue with a robust multi-pronged strategy to reduce COVID-19. And as I already noted, all of these areas early on in terms of, and I'm going to go into them in greater detail, but you can see they're here. This approach is grounded in data, aligned with recommended actions as expressed by CDPH in the Health Equity Playbook. And I'm going to describe these in a second, but now to give us the overall context and put things in perspective, I'm going to turn this over to Director Robinson.
Yeah, I just really briefly wanted to echo what Dr. Mesa said, that when we discovered that there were disparities in the impact of COVID in the Latinx community, we convened quickly to begin to strategize on how to address those disparities, and convened the Latinx Health Work Group that has been working with the county, the department, making recommendations. We've partnered with On the Move and entered into a contract for them to help lift a lot of the work that we're doing to address disparities within the community. And I just want to emphasize that, the proposed strategies that we have out now are just going to enhance that work and augment the work. And I would be remiss if I didn't call out and acknowledge the strong partnership and collaboration with the Community Foundation. They seeded and invested funding in this approach and in the strategies and funding the work that On the Move is doing. And so we're grateful for that partnership. We're grateful for their funding to allow us to lift the CURA project. And with that, I'll turn it over to Dr. May.
Thank you so much for putting that in context. So I'm just going to dive a little bit deeper into our strategies, and then we'll have a chance to answer questions. So our first strategy is to expand our testing opportunities. As you know, from probably April or May, when we first recognized that there was a disparity with our affected communities, we have been doing pop-up testing, extensive testing amongst the Latinx, amongst farm workers, in the lower socioeconomic groups. And it's been really, really efficient in finding people who have COVID, getting them isolated and quarantined and out of the community. Now, what we plan to do is to even more increase our testing. And the rationale is to increase case finding in these most impacted areas that will then decrease community spread, because we're finding not just symptomatic individuals, but asymptomatic people. And as we know, asymptomatic people with COVID likely don't even know that they have COVID and can transmit COVID. So we are focusing on the county's most socioeconomically vulnerable residents in those census tracts that I showed, as well as based on their economic status. So we're going to be increasing testing in these impacted neighborhoods. Beginning yesterday, the county has doubled testing opportunities with additional pop-up sites in these locations that are noted here, and we will be doing recurrent testing in these locations and trying to get more and more community members in these locations to come out, even if they're asymptomatic, and get tested. And the neighborhoods that are targeted are in the lowest 25% of the HPI census tracts. We will be now offering up to 12 testing opportunities every week. The goal is to do 400 tests per day while maintaining that 24 to 48 hour turnaround time at the public health lab. Our public health lab is now able to handle 1,000 tests a day. And of course, our public health lab is serving other healthcare organizations that are sending specimens. So we will be going from doing 200 tests per day to 400 tests per day through the county. And the focus again is going to be on Santa Rosa, Hillsburg, and Roanoke Park initially. And as we're able, we'll expand to other locations as well. So this is our timeline. This week through November 1st, our goal is to do 300 tests per day, utilizing existing staffing and beginning to recruit for some additional staffing for phases 2 and 3. And the phase 2 testing in the first 2 weeks of November, the goal will be 350 tests per day in the HPI focus neighborhoods. We will expand our capacity through extra help staffing of 3 additional bilingual, bicultural nurses and 3 additional community health workers, again, bilingual, bicultural. And it'll be 4 to 6 weeks for anticipated time for hiring. And we'll also have capacity to make online appointments to make things really simple and seamless as we're doing the testing in these events. Phase 3 testing will occur in the last 2 weeks, starting November 16th through June 30th, which our plan reaches to. And the goal will be to 400 to 500 tests in HPI-focused neighborhoods. And in this phase, we will include our participating healthcare partners, our federally qualified health centers and community health clinics, who will also be holding weekly testing events, and their goal will be 100 tests per event. Strategy 2 would be to enhance outreach to the Latinx community. And this health outreach and support is very, very important to get the word out, to get the message out, to educate people, to ensure that people come to our pop-up testing and get tested even if they're asymptomatic. So in the CDPH Health Equity Playbook, this is really underscored, and this is most effective when designed and delivered by community organizations that are already trusted institutions in the neighborhood that they serve. And we are partnering with and have contracted on the move to implement a large-scale outreach and education campaign to the Latinx and Indigenous communities. This is the CURA project, COVID-19 Urgent Response and Aid, and will support multiple different avenues of outreach and support. The Community Foundation is also giving financial assistance through On the Move to the Latinx, and we're augmenting this financial assistance as well. So what is the CURA project? It's really steered by On the Move. It's a unique partnership between multiple family resource centers and agencies embedded in the local communities. And the services provided include COVID-19 health information outreach to these groups, farm workers, local laborers, other Latinx, Indigenous language-speaking communities, access to necessary personal protective equipment for these heavily impacted groups, farm workers, and other high-risk workers, connecting these individuals to medical supportive services, supporting outreach around our neighborhood testing events that we've just discussed, and support in providing the emergency financial assistance that I've touched upon. What is this financial support and incentive? CURA will provide wraparound support and emergency financial assistance for those with the greatest financial need. And the testing team, our testing team, will coordinate with the CURA project to ensure that appropriate outreach is conducted near these neighborhood testing locations, that information is given out, that PPE is given out, hand sanitizer is given out, and that questions are answered, that there's always somebody who is bilingual and culturally sensitive there to answer questions that people have. And this is all going to be coordinated and timed so the outreach is happening within a day or two prior to testing and then on the testing site as well. The county PIO team is disseminating information about the expanded testing opportunities. It's on the website, the SoCo Emergency website, but also being projected out through social media, print media, digital media, radio and TV, and other communications platforms. Strategy 3 is to provide an incentive program and financial assistance. And this then again aligns with the CDPH Health Equity Playbook for isolation support. And that's strategy B, to provide access to necessary services and financial and material resources to help individuals adhere to isolation and quarantine recommendations. And then also to give direct financial compensation for lost wages and cash assistance. And this will help people come for testing. It'll increase our case finding. It'll help low-income individuals afford to isolate while they're COVID positive, and it will help their family members afford to quarantine as their contacts and as they're being monitored and tested. And the testing incentives in targeted neighborhoods will include the offering of $30 gift cards to encourage testing and help offset potential cost to individuals that are missing work and having to come to testing sites, paying for transportation, that sort of thing. And then the lost wage replacement that's been calculated based on our own costs here in our county to facilitate isolation will be a $1,216 stipend for a 14-day quarantine and isolation period. That'll be given to cases for the isolation specifically. Gift cards will be offered only at testing sites in target census tracts that make up that lower 25% of the HPI score, and for individuals in the most disadvantaged neighborhoods, as defined to be, as I said, in the lower 25%. Cards will be limited to one per month for people who come in for testing, and DH is predicting a 50% to 75% increase in testing demand in target groups based on data from counties that do have similar incentives for testing. The lost wage replacement, which I just discussed, the $1,216 per isolation per adult, a one-time payment, is going to be very, very effective. And the rationale is that it equals the highest minimum wage in 2021 across Sonoma County cities at the rate of $15.20 an hour in Santa Rosa that starts January 1st, 2021. This is for those working 40-hour week, and the maximum time out of work would be 14 days, and that's what it's calculated on. The target population will again be offered to residents living the lowest 25% of the Healthy Places Index census tracts, and for others who do not have access to financial coverage during isolation. The funding will be provided in two tiers. The first tier would be for confirmed adult COVID-19 cases who lack the access to paid leave or any other compensation, or whose household income is below the poverty line, including laborers, independent contractors, people who receive payment under the table, and undocumented workers. And this also extends to confirmed unhoused COVID-19 cases. The second tier, if funding allows, would then extend to adult contacts of confirmed cases who are required to quarantine for 14 days and meet the eligibility requirements as set forth. Our fourth strategy is to foster our already built partnerships with the business community. And the rationale for this is to ensure that we're getting and reaching our frontline and non-medical essential workers to protect the safety and well-being of these workers who are continuing to provide essential services throughout the pandemic, or those who work in occupations that can't be done via telework. DHS will work with the EDB and key business industries to enhance worker education on infection prevention and control practices, and to share information on testing and the incentive programs that are available. Businesses are also encouraged to partner, lead, and invest in enhanced COVID-19 mitigation strategies to help the county progress towards reopening the economy safely. We've already held webinars and calls with certain groups to explore innovative and new ways in which these partnerships can help us in our fight against COVID. We'll be partnering with the Economic Development Board and local businesses with really a strategic focus on highly impacted industries, wineries, dairies, farms, food production, childcare, and tourism organizations. Again, to enhance worker education and to promote information on expanded testing opportunities and incentive programs. Areas that we identified for public-private partnerships to help fund or support the COVID-19 strategies include support for increased testing, offering on-site testing at places of employment, perhaps through a contractor such as Curative or Color Genomics, perhaps in partnership with CDPH, who are going to try to start offering more of these pop-up testing or mobile testing platforms. We can also partner on support for financial incentives for testing and isolating, to provide increased bilingual outreach, to identify hotels through our tourism industry for isolation for vouchers, and to model best practices in encouraging testing, supporting employees who test positive, ensuring safety protocols are followed for workers and customers, and that employees feel safe during the time if they are diagnosed as either a case or contact to COVID. Our fifth strategy will be to provide isolation and quarantine support The ability to effectively isolate is a critical component of limiting the spread of COVID-19. As you can see from the data that we provided, there is ongoing transmission of COVID in large households and in workplaces as well. So it's really important to get people isolated as soon as they're diagnosed and away from others who could be transmitted and transmission of COVID could occur. So we've already been doing this in the form of our alternate care sites, first at SSU and then in Healdsburg. But this would provide for us to secure additional hotel space closer to home, closer to the targeted census tracts, with input from Latinx community leaders to try to get more people to isolate in an alternate care site or a hotel space once they're diagnosed with COVID, or if they're a contact and need to quarantine and can't do so safely at home. Again, we talked about incentives, but this is an additional gift card incentive to individuals who choose to isolate at the alternate care site or the additional locations that we are going to be identifying. And also to provide mobile medical services, perhaps through DEMA, and provide additional wraparound services such as medication delivery, meal, grocery, laundry services, again, using our partners. And based on the stakeholder feedback that we've gotten, the alternate care site currently that we have, the location in Healdsburg, is a barrier to utilization. So we seek to secure 35 additional hotel rooms that are closer to the Santa Rosa and Petaluma, the areas where we identify the census tracts that are in that lower 25%, so that people feel comfortable going to these places. And we will consult with the Latinx Health Work Group to ensure that there's cultural appropriateness of all of these spaces, these new locations, and of the existing ACS. And then, of course, as I just mentioned, to provide mobile medical care and wraparound services. Strategy 6 is to create communications and an education campaign. Enhanced and targeted communications will help to increase participation in testing, understanding isolation and quarantine guidance, and understanding what resources are available to support people through their diagnosis with COVID or of their contact to COVID. So the County Strategic Communications Team is proposing a health equity education and outreach campaign using multiple platforms, radio, print, TV ads in Spanish and English, in addition to supermarket videos, social media messaging, geo-targeted digital advertising, to get the message out, to let people know that there's a lot of resources out there for them that they can utilize. And then continued partnership with the Health Services Latinx Health Work Group to develop outreach programs aligned and that support the CURA project and in tandem to ensure that there isn't duplicative efforts, but that we're all working together. The new COVID-19 marketing campaign will focus on promoting expanded opportunities for testing and incentives available to encourage testing, financial support available for the low-income COVID-positive individuals, as I've just laid out, to really avoid large gatherings this holiday season and have a universal theme of mask up, back up, and wash up, and don't let up. The DHS and comms teams will work to promote other outreach via culturally appropriate outlets to better target these populations that are heavily affected, the Latinx and other communities. Here is a graph that shows the cost of our different strategies broken down. And really the take-home message is that it's going to be close to $16 million to provide all of these strategies until June 30th, 2021. And in the short term, Health Services is proposing to redirect $3.3 million of the CARES Act funding from the COVID-19 response plan to the enhanced COVID-19 strategies that will be utilized from now through December 30th of 2020. The board contingencies funding of $666K is proposed to fund the incentive cards for individuals who are participating in the testing and isolation programs. So again, that's approximately $666,000. The department is able to redirect funds due to savings that we've had in testing, staff hiring for the COVID-19 section, and in the non-congregate site located at the fairgrounds. That's where these redirected funds would be coming from. And at a later date, the department will come back to the board to request funding of the $11.9 million for the rest of the enhanced COVID-19 strategies from December 31st, 2020 through June 30th, 2021.